Hello, my name is Dr. Mary E. Money. I'm a board certified internist, and I've been practicing in Hagerstown, Maryland since 1979 as a primary care physician up until this year. This year, I decided to transition to provide telemedicine consultation services for anyone in the state of Maryland. What I'd like to do today is present some information about general topics on when you should seek medical attention or what you should do if you're having a particular medical problem. This is not all inclusive, but just a few tips. Please understand that no material on this slide is intended, or what I say today, to be a substitute for you getting professional medical advice in person. The first topic I like to discuss is what to do with cold symptoms. As you know, this is a virus. So if you're having some mild achiness, sore throat, slight congestion, you don't need to seek medical attention, but you definitely need to test and make sure that this is not COVID. In order to make sure it's not COVID, I would suggest that you do a rapid test daily for at least 2 to 3 days and be sure to get your COVID vaccinations. How to manage a cold symptom is pretty obvious. You want to follow the instructions that your mother gave you. Drink plenty of fluids, get plenty of rest, take Tylenol, but don't go over 2,000 milligrams in 24 hours. Mucinex is great for head congestion. Saltwater nasal spray several times a day. If your nose is still stuffy, you can use some Flonase. But I would suggest that you try to avoid the over-the-counter medicines that are labeled head and cold. Quite often, these contain a substance called pseudoephedrine that could make a person's heart race, raise the blood pressure in seniors, cause you to have trouble sleeping at night. It's not really a safe medication for seniors, so be careful about that. Now, what if you have a fever or an earache or stiff neck or some confusion? Those are all things that you should seek medical attention for. Quite often, a person comes to me and tells me that their loved one or their partner is confused or is sick, and they refuse to go and see the doctor. Please understand that in that situation, that loved person is not thinking clearly, and it's important for you to assume the responsibility of getting them seen. Don't make the mistake of letting them dictate their care if they're not of a sound mind at that time. Many patients have asked me over the years, what if my secretions turn yellow or green or brownish? Shouldn't I have an antibiotic? And the answer is no. Antibiotics are not indicated at that time. And as good stewards for antibiotic usage, physicians are encouraged not to just simply prescribe for a discolored secretion. Instead, I would encourage you to watch the color of your secretions, and if they're beginning to get lighter, that means you're actually winning. Your body is getting over the infection on its own. Antibiotics are not going to make a difference. Remember, antibiotics do not hit viruses, and most of the cold symptoms are a coronavirus. Why is it so important to avoid antibiotics? Antibiotics kill the good bacteria in the intestines. And those bacteria are what we now recognize help the body in numerous different ways, particularly with the immune system. If you kill those bacteria, unfortunately, it's going to take 6 months for them to recover. And if you wipe them out, then other things can grow that are from spores that are not affected by antibiotics, such as Clostridium difficile, and it could cause major infection in the intestines that may take multiple times of antibiotic therapies to get rid of, or even a stool transplant. So please try to avoid the antibiotics. In addition, antibiotics will change the bacteria. The bacteria will learn how to grow in spite of them, and so we'll have more antibiotic bacteria resistance. Now, when should you suspect that a person is having a stroke? Dizziness is not one of those. But if you have a symptom that you're vision changes, like a curtain is going up or a curtain is coming down in one eye. That could be a sign of a stroke, and you need to get medical attention right away. If a person is unable to speak clearly, repeating their words, slurring their words, confused, those are all signs of a possible stroke. But numbness in the hands when you're trying to hold something or peel a potato, that could be carpal tunnel. Just like pain shooting down the leg with weakness could be a pinched nerve. Key things to do if you suspect your partner or a friend may be having a stroke is listed here. Pause this slide for a second so that you can memorize these things. You want them to close their eyes, wrinkle their eyebrows, smile, stick their tongue out, raise their arms, speak after you, and if they can't do those things, then you need to seek medical attention. Remember, time is really of essence. Every minute that is lost could be brain cells that are killed. A lot of my patients have asked over the years how I should take care of a person if they're beginning to faint. It is very important for you to get that head down and not try to keep them upright. The head is where you need to have the blood going to, and if you keep them upright, the blood's not going to get there as easily. Their blood pressure has dropped, which is making them have the feeling of fainting. So please get that head down between the knees, lie them on the ground, get the legs up. Chest symptoms are confusing. Everyone says, well, isn't this a heart attack? Remember, there's over 30 different things that will cause chest pain. It can range from just simply acid indigestion to a skin irritation to muscle problems to some pleurisy. So don't assume that it's heart. It's very important for you to pay attention to what makes the pain worse and what makes the pain better. However, classical heart symptoms are when you have a heaviness in your chest. You might have discomfort either in your neck, your ear, your shoulders, your arms, but it is associated with exertion. When the heart is exerting itself with the exercise, it needs more blood. And if it doesn't get the blood, it's similar to you tying a string around your finger and having the pain begin in the tip of the finger. That's because the muscles are not getting enough blood in the heart and the pain is produced. So activity that causes pain goes away when you stop. You have to think about a heart condition and contact your doctor immediately. But whatever you do, don't wait. If it's severe, call 911. Don't put it off, okay? If a person is vomiting, it's important for a senior to immediately get medical attention after 2 to 3 hours of vomiting. Unfortunately, that could lead to a kidney problem or dehydration. If you're a diabetic, you need to contact your doctor and find out whether you should be taking more insulin if your blood sugar is high, or even cut out some diabetic medications. So please call someone if you're having trouble keeping food down or liquids down. Well, in summary, thank you so much for listening. I hope you've enjoyed it. I hope this has provided you with additional information on what to do. If you're just having a mild cold symptom, you don't have to go contacting your doctor, and just take good care of yourself. But be sure to check for COVID and that you're not going to be contagious as someone who's immunocompromised. If you're having any type of chest discomfort that is associated with exertion and then goes away when you stop doing what you're doing, please see your doctor and make sure that this is not an underlying cardiac condition. And remember, chest discomfort that's coming from the heart could be felt any place above the belly button. It could be in your neck, your shoulders, your back, your arms, even your ear. So if you have questions and would like to have a medical consultation, I'm happy to consult with you. This is only for individuals who live in the state of Maryland, however. My telephone number is 301-824-9240. and I'm happy to answer questions and see if a consultation would be appropriate. I do not participate with most insurances. However, I do accept Medicare and will submit the claims directly to Medicare and then bill you for any type of a copayment. Again, I hope you've enjoyed it. Please check out my website and look forward to seeing further YouTube channels from me on various topics related to medicine. Have a great day. Take care. Stay well.